And we can look at it in terms of some category or some broad areas. One of them has to do with functional user-related challenges. But this, I mean, difficulty with inserting or using the condom. Some reports from females indicate that they are not able to use the condom by inserting it. And that is because we think that they are not properly trained on how to use it. So that's one part of it. Then also, in terms of its comfort in using, if you look at the female anatomy and the male anatomy, there are differences. For the male anatomy, it's easy to insert the condom, but for the female anatomy, they need some level of skill to be able to insert it appropriately so that it can be comfortable to use. And that is another barrier that we have realized, and a misconception that some females just think that the procedure in inserting it and using it already is cumbersome, and so they don't even want to make use of it. And of course, that also is linked to lack of knowledge and adequate skill by people. Then we also have issues around cultural practices, some partner acceptability. Some females, their male partners, find it difficult to allow their wife or their partners to use it for various reasons. And so because of that, the females are not encouraged by their partners to use it. They also have cultural and social stigma. We know that, I mean, in our culture, the issue around sex is very, very sensitive. And then sometimes if the woman is the one demanding or leading in saying, I want to use the female condom, it creates an impression that she's promiscuous, she's not properly brought up. And so that is also a barrier. It's a cultural and social stigma and gender issues. And that is also another issue that is affecting its use. Women have limited power also, as I said, in terms of relationship. And so they are not able to make decisions for themselves. And that is also related to the cultural bit. So these are some barriers that are affecting the use of the female condom in our setting.